We will begin. Good morning, everyone. For those of you who don't know me, my name is John Brandon. I'm Senior Director of the International Relations Programs for the Asia Foundation in Washington, D.C. I'm very pleased to moderate this webinar this morning where we're going to be discussing a recent report that was released by the Asia Foundation's Thailand office. It's titled Revisiting the Pandemic: Surveys on the Impact of COVID-19 on Small Businesses and Workers. You might recall we held a similar type of webinar last October where we did our first survey to talk about the impact of COVID-19 on the Thai economy. While Thailand has certainly had much fewer infections and deaths than many other countries around the world, including the United States, nonetheless, it has taken it. The economy has taken a tremendous beating and a severe impact on the economy. And the question is how it might recover and how long it might recover, especially for small and medium-sized enterprises. So I'm pleased to have as our two speakers this morning, Thomas Parks, who is the Asia Foundation's country representative in Thailand, based in Bangkok, and Dr. Nalitra Thaiprasert, who is a senior program officer who manages our economic programs also in Bangkok. The Thailand overall program portfolio addresses inequality, education reform, digital technology, as well as international relations. Tom has been with the foundation for more than 15 years in various roles. For many years, he directed our conflict programs and has expertise working in programs in the Philippines, Myanmar, Indonesia, and Cambodia. And from 2013 to 2017, Tom worked for Australia's Department of Foreign Affairs and Trade, where he served as a senior governance and fragility specialist. Dr. Nalitra Thaiprasert joined the Asia Foundation in October 2020. As I said, she's our senior program officer for economics. She's the principal author of this report that we're talking about this morning. Her program responsibilities look at economic reform initiatives, including competition reforms and bilateral trade and investment issues. Prior to joining the foundation, Dr. Nalitra was an assistant professor of economics at Chiang Mai University's economics department, and she's conducted also research for various UN agencies, including UNICEF. She has published widely. In 2014, she received the Golden Elephant Award for Best Young Researcher in Social Sciences at Chiang Mai University. And Tom Parks will speak first to sort of set the stage. And then Dr. Nalitra will talk about the findings of the report. We will then open it up for Q&A. I ask people to, when they pose their question, to do it in the Q&A box, not in the chat box. We won't be looking at that. This discussion is on the record, and it is also being recorded. And so therefore I ask, when you do pose a question, if you would kindly identify yourself and your institutional affiliation. So thank you again for coming, and Tom, the screen is yours.
Thanks, John, and thanks everyone for joining us today. I will keep my remarks very brief so that we can quickly get to Dr. Nalitra's presentation of the study. As John was mentioning, Thailand's overall cases, and impact in terms of the pandemic has been, of course, lower than many countries, including here in this region. But while the US and others are returning to some degree of normalcy, today was in fact Thailand's darkest day in many ways in the pandemic. Today we had the highest number of deaths ever and over 7,000 cases in one day, which is, while not the highest, it's the second highest, and it's been creeping up regularly for about a month now. And now the government's talking about a new lockdown possibly starting as early as tomorrow. So the country really is in crisis right now. The Delta variant has become the most significant, the majority of cases here in Bangkok. Hospitals are full. We're looking at now 3.5 straight months of some level of restrictions. And in fact, actually since January, 4 out of the past 6 months, we've had some degree of restrictions. And of course, this is hurting the poor, it's hurting small businesses, it's hurting the tourism sector very, very hard. The government right now, as you might imagine, is under intense pressure to try to get back on track. And it's the response really has been quite different from last year. When we gave this presentation in October, I believe, of last year, the first report that came out, Thailand was seen as a success story. And I think that that seemed like a distant memory at this stage. I think it's also important to note, and Dr. Nalitra will go into this more, but the anecdotal evidence of economic impact is visible everywhere here in Bangkok now. We're seeing more and more boarded up shops, dark hotels. The homeless are increasing in number, like I've never seen here really before. And of course, tourist areas are completely empty. We also saw yesterday that the news came out that the consumer confidence level was at a record low in June. And so there's all kinds of indicators that this is really quite a significant crisis. There are some bright spots. Exports, interestingly, are up. And there has been some sign of a recovery in investment. The Japanese in particular, private investment has really increased quite a bit recently. Just a couple of days ago, there was the first quarantine-free visit for tourists in what they're calling the Phuket Sandbox, an experiment to try to allow vaccinated tourists to go to Phuket without quarantine. And so all of these are early stage, possibly pointing in the right direction. The vaccine rollout has been chaotic and has disappointed many. The government has failed to reach most of its targets, but it is trickling along with mostly AstraZeneca and some Sinovac as well. And there are some signs that there will be more coming. I won't talk right now about vaccine diplomacy, but the government here was very pleased that there was a donation from the US of, I believe, 1.5 million Pfizer vaccines announced that should be arriving soon. And that, I think, is desperately needed and was a really, really good signal. Now, this survey, just a few words to explain kind of what this is and bring everyone up to speed. So we did a series of 3 surveys starting in May of last year, which looked at small businesses and workers. In the small businesses area, we particularly looked at the tourism sector and manufacturing. And the labor survey was actually the entire labor force. We did this over 3 rounds, going back to the same people. And so what we've done is we've tracked their sort of journey through the pandemic. But it's important to note that it tracks only the impact of the first wave and between the first and second wave, and then it tracks the impact of the second wave, which was in January. It does not track the impact of this current third wave. And so we can imagine actually that the data we see tonight or today is actually it's actually quite a bit worse now than probably the data even shows. So let me stop there. I can talk more later in the Q&A if people are interested about vaccine diplomacy, about the prospect of an election next year, and other issues like that. But let's turn now to Dr. Nalitra. Thanks.
Thank you very much, John and Tom, and good morning, everyone. It's my pleasure to have this opportunity to present our research finding to you today. Since I only have 25 minutes to present, I will go very quickly, but if you need me to explain anything more, I can come back during the Q&A session. So let me share my screen now. Can you see it?
Yes.
Okay. Okay, as Tom has already mentioned to you, we collected 3 rounds of surveys, and They are the panel data, but I'm not gonna go into details. Sorry, I have to move this small screen. Okay, so this is the key question that we asked. If Thailand faces COVID-19 for another year, how long do you think you can last given your income, savings, and all that you have now? With this, we also collected other demographic and economic data from them. We basically used the result from the regression analysis and the we call it survival probability parts that look like the one on the slide to present most of the results in the report. Now we will start discussing the impact on the Thai workforce. This first figure shows that the survival probability path from shows the survival probability path from the 3 periods of data collection. You can see that the results are not that bad as this survey happened before the second wave of the pandemic. In general, the same workers were doing better in the 3rd period around November last year than in the 2nd period in August and in August and the 1st period, which was in May, because you can see the blue line is above the green line and is above the red line. So we have some interesting data that fewer than 50% of the sample workers had enough savings or a stream of income to sustain consumption for only 6 months. But workers had become more aware, so they saved more in the 2nd and in the 3rd period of surveys, which is good. In May last year, or the first round of the survey, we found that people were less prepared, as we found that 2.7% of them could not survive more than 1 week. This disappeared in the 2nd and 3rd rounds of survey. So I'm showing this table just to let you see quickly our result from the regression analysis, which will be discussed from the next slide. So all the important findings are on this page. Many of these results are what we had expected. You can see that on the right-hand side, the red color letters, these are the demographics or group of people who have a higher chance, lower chance of survival. So they were female, 25 to 59 years old, or the working age adult. The reason could be that they had a lot of dependents. So when the COVID hit, they had to take care of their dependents. And you can see that why the elderly people seems to have higher chance of survival. This is because the elderly people in Thailand now would receive a stable stream of income, such as the old age pension or the social security pension or the government pension. So they could survive better. And the group of people who have low education, like primary, secondary, diploma, will have a lower chance of survival. Workers in the Northeast and in the South were worse off. The reason for the South, obviously, because the South is dependent on tourism. In the Northeast, this is the region that's the poorest in the country to begin with. In terms of occupation, the unemployed and unskilled workers were worse off. And in terms of sector, tourism sector and other services sector were impacted most. And informal workers had a lower chance of survival. And the people or workers that borrowed the money during the pandemic, because of the pandemic, so they had a lower chance to survive. Now, we have another, three more variables that we want to discuss in detail. So going back to hometown, you know, one of their behavior adjustment, only a few percentages of them went back to their hometown. And this variable doesn't show a significant result. Maybe because vulnerable workers who went back home would survive. So these two effects cancel each other out. In terms of training, again, only a few percentages of them received some career or skill training, and the effect that we can see from training is likely to show up much later. So the result was not statistically significant. In terms of borrowing, as mentioned in the previous slide, the result was significant and showed that workers who borrow money because of the pandemic had a lower survival chance. But the result also showed that 85.8% of workers went deeper in debt during the pandemic, and they were able to access the loans. But I guess that most of them would be loans from the loan sharks. Now, the following three slides will show result by survey period. Please look at the far right bar. Roughly 20% of the workers continue to see their incomes decline in the second and third periods, when the situation had already improved in August and November last year, before the second wave came. On average, from all three survey periods and all regions, 59% of Thai workers predicted that they would not survive for more than 1 year. This figure shows that workers borrow less in the second period, but slightly more in the third period. And workers in Bangkok borrow more than workers in other regions. This figure shows that there were three main policies which workers benefited from, which are the cash support of 5,000 baht, or around $160 a month for 3 months, to low-income informal workers. I will call it type 1. Second is the severance pay by the Social Security Fund to the former workers who had lost their jobs. So this is type 2. And the third one is the cash support for 5,000 baht a month for 3 months for farmers. I call it type 3. So we only collected this data in the first and second rounds because they already ended by the time of the third round. The regression results show that type 1 and type 2 recipients were less likely to survive, which could imply that although the program couldn't lift them up from hardship, but the policy had successfully targeted the population that needed assistance. The regression result doesn't show the causality, but more about correlation, interaction. Type 3 recipients, they were more likely to survive because 15,000 baht that farmers received over 3 months lasted a long time, as they already had more access to food in the rural area. The other 3 programs that show in figure 21 were not popular at all among our survey respondents, so we did not have the data to discuss. Besides these 6 programs, there are more programs released by the government after our last survey in November last year, so we couldn't capture them here. And here is one additional program released around the time of the third round of survey called Half-Half, which is a program that the government pays half of the price at eligible stores with the daily minimum of 150 baht, or around $5. This program has been quite popular and it has been extended for 3 times until now. This slide shows that the reasons why workers did not participate in this program when it first came out is related to the difficulties with technology adaptability of the recipients, as Half-Half requires users to have a smartphone. So you can imagine that this program has also left many vulnerable people behind. I think that if we ask this question again now, we could have very different answers, especially the one related to how to register and their willingness to participate in the program. Now, let's move on to the impact on micro and small businesses. For the small businesses, you can see that this figure that has the survival probability paths for 3 periods is different from the one from the workforce survey you saw earlier. The businesses perform worse in the 3rd period than in the 1st period. As you can see that the blue line hangs lower than the red line. Only in the last few weeks that the red line hangs lower. So this means that because we were lucky enough that we could collect the data twice during the 3rd survey period, or before and after the 2nd wave broke out. So we could capture how the 2nd wave has done the damage to our small businesses. Again, all the important findings are on this page. Many of these results are what we had expected, but some are surprising. In terms of size, let's go with the group that have lower chance of survival, would be the smaller businesses. The size means in terms of number of employees before the pandemic. And the businesses in Bangkok and the North got impacted more. This is surprising because we thought it would be the South, but the reason is that when the situation got better, it turns out that Thai people travel domestically and they went out to the South, to the Northeast, you know, to have their vacations, but no one wanted to come to Bangkok for a vacation. So basically hotels in Bangkok went bankrupt, many of them. For the North, it was dominated by just one variable. When we asked, you know, would you be planning to lay off your workers in the next 2 months? And it surged a lot in the North. So that's the reason why we see the North here. The type of business, the business related to tourism, like hotel and accommodation, travel agents, tour guides, and tourist transporters, these are all having lower survival chance. And the renters would survive, have a lower chance to survive than the businesses that own their business premises. And the business that rely on imports would have a lower chance to survive. In terms of revenue, the one related to tourism also said that their revenue haven't come back to the pre-lockdown level. Lockdown was between March 26 to May 3rd last year. And for the risk, we asked them to perceive themselves if they have a high risk or not. And these people, these businesses, the tourism related ones, said they had high risk. Interestingly, the restaurant and food and beverages seems to fare pretty well. They adjusted quite well, which you can see later, the coping strategy that they use. The businesses that need more adjustment also would not survive that well. And the businesses that said they had to reduce their working hours or they already closed temporarily, these will have lower chance of survival compared with the one on the left-hand side, laying off staff, you know, the green color. Interestingly, if you decided to just lay off your staff, you tend to have a higher chance of survival than, you know, keep reducing the hours and keeping your staff. The coping strategy The one that did not work well is like introducing new products or services, like try to sell face masks or hand sanitizer, even though these are not your product. You know, you just want to have some income, but these have, you would face fierce competition, right? And oversupply in the market. So it's not a good strategy. And another bad strategy is trying to reduce staff salaries to keep all of them. The good strategy, positive one, would be operate with social distancing, such as trying to work, allow working from home, or try to provide delivery services for the restaurant. And many, if they come to online platform or social media for marketing, it seems to have a positive result. In terms of soft loans, the businesses that not yet received soft loans had a lower chance of survival, but the one that already received soft loan have a higher chance. Again, this is not anything about causality, it's all about correlation. So the next 4 slides will present the result by survey period. In the third period, we have 3 results to show. The green bar is the average for the whole third period. The yellow circle, or 3A, only captures results before the second wave. So their results are better than those of the green bars and the green circles. The green circles, or 3B, only capture results after the second wave. So their results are worse than those of the green bars and the yellow circles. So this slide shows that revenue did improve before the second wave, see the yellow circles, but became worse after the second wave, see the green circle. So not surprising, right? This slide shows that more businesses perceive themselves as having a high risk in the 3B period or after the second wave came, although this perception did decrease significantly in the second survey period already. This slide shows that there are lower number of firms with positive results in the 3B period, such as working as usual, but there are higher number of firms with negative results in the 3B period, such as business is temporarily closed or already laid off some staff. Results from the regression analysis show that businesses that could work as usual or already laid off some staff had a higher chance of survival than those that had to reduce their working hours to minimize layoff. This slide shows that as of January 2021, more than a third of businesses still had not changed some aspect of their operation at all. And the second wave of the pandemic interrupted the use of online platform or social media for marketing that I said before that is good strategy. And more businesses had to adjust by reducing the salary of their staff instead. For the support policies for small businesses, we could only capture most of these policies in the third period of survey. So there is no regression analysis for these government programs. The slide shows that as of January 2021, soft loan program seems to be the program most in demand by small businesses, followed by the We Travel Together and half-half. We Travel Together is a program that the government subsidizes your domestic trips for airfare, hotel stays, and even meals during the trip. Shopping tax rebate did not turn out to be in high demand because this program was only popular among formal taxpayers. But Thailand is a dominantly informal economy. Now let's move on to the conclusion and policy recommendation. We have come up with 7 of them. First is we should give a lot of attention to tourism sector since it was hit hardest. The government introduced We Travel Together last year, and it was quite successful. They should do it again this year after solving all the problems related to fraud and program misuse. The government also needs to clear up its vaccination plan and timeline, the travel bubble plan, which I don't know any country want to have this with Thailand anymore, and vaccine passport guidelines also. Second, Thailand should move towards high value or high value over high volume tourism. So it's good for the environment also. This means a lot of tourism workers will be let go forever. So we need to reskill them for other sectors, such as for the care sector. As you may know, Thailand will be an aged society next year, when we will have around 14% of population older than 60. Also, if we allow more high-skilled foreign workers to work in Thailand, it could help in many ways, not only helping the tourism sector, but also let skill or technology transfer to happen easier. Third, female workers are more vulnerable in the current downturn. This means we need to think more seriously about how to provide more childcare and elderly care services to women so that working mothers or daughters can continue working and stay in the labor force. The ones who can no longer return to their old jobs should be reskilled or upskilled. Oh, sorry. Okay. Fourth, the Thai social protection system should not be so dependent on individual officials' discretion. Right after the outbreak, the government took a lot of time to figure out where the vulnerable people were, so the assistance came quite late. I think what we call automatic stabilizer, like how an unemployment insurance works, should kick in to support affected people and businesses during a lockdown, during a downturn. And we should also revise law and regulations for this. Fifth, there should be a better system for data integration to support government social protection and relief programs. And the agency that have the right to use the data should have a written legal authority and be protected by law. Because now they seem to be afraid of sharing the data. Six, key changes to the soft loan program are needed. This is because soft loan seems to be the most important program that can help small businesses, but so far it has not worked well in terms of access. The Bank of Thailand should relax its eligibility criteria and need to promote soft loans more broadly and effectively. Or the government can just set up a special entity to process soft loans for small businesses, such as like the US Small Business Administration did. Last but not least, Thailand needs to do more and do it quickly in terms of providing assistance and stimulus programs. What's still lacking as of today are the subsidies for all businesses forced to close temporarily or reduce their operating hours, and employee salary support program for businesses that are in trouble and or could be forced to shut down permanently. So far, only the construction and restaurant businesses have received some support since June this year. So that's all for my presentation. Thank you for your attention.
Thank you. Thank you, Dr. Nalitra and Tom. We'll now go to questions and comments. Our first question will come from Doug Clark. He's a retired USAID official. He has served in Thailand, but also Laos, the Philippines, and Egypt. His question is, as a significant food exporter, what is the status of these export markets? Is this a sector of the economy that has promise as the long path for recovery of the tourism sector proceeds?
Sorry, I was trying to minimize my screen. Can you say it again?
Sure.
If you look at the Q&A, if you hit the Q&A button, you can see it actually.
Okay.
Yeah, maybe let me start really quick, and then Nalitra, why don't you jump in on this question? So I think that I mean, right now the agriculture and the food sector hasn't really been that effective. If anything, it's actually ticking along pretty well. But whether it's actually a significant factor in helping get through the crisis in the tourism sector, it's really not. I mean, in a lot of ways, agricultural jobs here in Thailand, very low productivity, very low income, and so they tend to act as almost a sort of an informal social protection or resilience mechanism that allows people to survive in difficult times. But it's not really it's not a long-term answer for the country to get back on track. What's really required is to help move people from service sector tourism jobs to either other more viable service sector jobs, or move them up into higher skill jobs. And that really, I think, is the critical issue that's facing the country right now. Nalitra, do you want to add to that?
I agree. This is a long-term problem that we have. You see that with the same level of GDP per capita, Thailand should already have much smaller percentages of people working in agricultural sector, but we still have more than 30%. But the contribution of agricultural sector to the GDP is only around 10% or less. So this means you cannot rely our economy on agricultural sector, and I never feel we have to be number one rice exporter or durian exporter. What's the point, right? Yeah, but the way to go is to have higher value added products, high tech, and move on to the we call the S curve, the advanced manufacturing or advanced services sectors.
I just want to add that, I mean, that's indeed a key challenge. I mean, you have the largest sector of the economy, at least in terms of number of people employed, is the agricultural sector. But it produces, it's anywhere between 40 and 50% of the population, but produces only probably about 8% of total GDP. So how to move these individuals, if they're going to be able to continue to make a livelihood and to make Thailand's economy more competitive, how to move them into these other sectors is definitely a key challenge for this government and any future government. I'd like to ask I'd like to ask the next question. You mentioned, Dr. Nalitra, that Thailand has a dominant informal economy. I remember reading before the pandemic that Thailand had one of the lowest levels of unemployment in the world, less than 1%. Clearly, that's not the case. Has there have any studies been done on what is the employment rate now, realizing that it's hard to gauge this, given that Thailand does have a dominant informal economy?
Yeah. I think the reason why the figure was very low was because of the way we collected the data, right? But even because of that technique, right now the unemployment rate has gone up so high, much higher than previously.
Is there a statistic for that?
Before it was like 0.5%, right? Before the
pandemic. Certainly before the pandemic, yes.
Right now it's probably 4 or 5%. Yeah.
Which is significant because it's worse.
Yes, more than 10 times. So it's very bad. And we don't have a good system like in the US. You cross-check between the BLS and the BEA, right? The You can have
What is the what is the BLS and the BEA?
Bureau of Labor Statistics.
Oh, okay.
And the Bureau of BEA, economic something. Yeah. So the one gives the unemployment based on you survey the firms, how many people you laid off last week, right? And another way, you look at them by the payrolls, right? The one that register for unemployment insurance. Yeah, and you match these two data sets. In Thailand, we don't have luxuries like that. So, and I asked the National Statistical Office, like, how you collect the unemployment data, and they're like, oh yeah, we call them and just ask, did you work just one day in the last month? And if they say yes, they already employ. Yeah. It's not a reliable way. So yeah, we have a lot of problems with our data.
Indeed. Our next question comes from Jared Weir. He's works at the U.S. Embassy in Bangkok. His question is, has there been any political fallout from the third wave? Will this impact positively or negatively the chances of an early election? So Tom, I don't know, maybe you want to.
Yeah, let me jump in on that. And Jared, actually, thanks for the question. Jared's at the European Commission, actually, here in Bangkok. I mean, Jared, I think you probably would agree that I think this significantly increases the chances of an early election. There's already talk about a no confidence vote next month. Pheu Thai party is likely to raise this in the parliament, National Assembly. I think that the government's been under enormous pressure and really has lost a lot of its allies from before. And we've also seen quite recently that some of the protesters that were quite active last year on Thai politics, on the constitution and on the monarchy, are now starting to protest about the government's response to the pandemic, and that is new. And so I definitely think that it significantly increases the chance of an early election, and I think it's really hurt the government's chances of another term. There's also, as Jared would know, quite a bit of activity right now of key political actors organizing new parties. One of the most interesting ones is a former Pheu Thai leader named Kunying Sudarat, who has started a new party called Thai Sang Thai. And that's getting quite a bit of traction, actually, and could quite possibly pull a lot of voters from Pheu Thai and from a couple of other parties to really make a challenge. So, if there is an election soon, I think actually it's really, really up for grabs. So yeah, I do think that that's going to be probably the big story of next year.
Thank you. Our next question comes from our colleague, Sophia Shakil. She's the Director of Economic Programs for the Asia Foundation. Her comment is, reskilling workers from the large employment sector of tourism ecosystem is rightly necessary, especially for other emerging services industries such as elder care. However, there's a time lag between loss of livelihoods and effective reskilling, and then employment to this end. Social protection programs in terms of income support and stipends during training are really important. Is the Thai government planning for such programs? Secondly, how nascent or vibrant is the private care provider sector? And is the government planning significant PPPs in this sector? To either of you. Go ahead.
Okay. As far as I know, the government is really aware of this now, and they see the opportunities, not only for Thai elderly people. We will enter the age society next year, right? But they also see the opportunity for Thailand to be a hub to receive seniors from around the world. However, I don't think we have enough workforce in the care economy yet. And there are very limited centers that train them professionally. So I think, you know, the government really needs to get serious about this and do this, you know, provide some real action if they, you know, really want this to happen soon. Yeah, and the PPP, public-private partnership, right? Yes, many private hospital in Thailand already providing trainings for the care economy, like elderly care and child care. Yeah, but still not enough, you know, we need more actions.
Okay. Our next question comes from Jeff Sr. He's with the Canadian Embassy in Bangkok. He says, can you please elaborate on the increase in foreign investment, including from Japan, to which Tom referred to in his introductory remarks? Secondly, can you please comment further on the improvement over 2020 in worker survivability? While informality seems to correlate clearly with vulnerability, is informality also part of the resilience and coping mechanism for workers, along with increased mobility, government support, remittances, etc.?
Thanks. Let me take the first question, if that's all right, Nalitra. Jeff, you know, the figure I'm quoting is from a Nikkei article in February, basically indicating that Japanese FDI in Thailand was actually 36% of Thailand's overall FDI in 2020, and that their investment actually had increased 10% from 2019, which I found very, very interesting. Now, just to be clear, I don't have the overall figures on FDI coming into Thailand, which I understand are, you know, are sort of a modest increase, but I don't have those figures with me right now. So Nalitra, do you want to? I mean, my sense for the second question on worker survivability improvement, I think that a lot of it was workers basically learning how to adapt, being a bit more resilient, but also was the timing of the surveys. So the first survey was done when the country was deep in the first wave and everybody was very worried about when we would come out of it. But the second and third surveys were done when things were relatively back to normal here in Thailand. So in that way, unlike the small business, it doesn't really capture the sort of the edge of the second wave. Does that sound right to you, Nalitra?
Yeah, well, if we dig deeper, the informal workers, the regression result was not significant. This is because the characteristic of the informal workers tie with their occupations of, you know, working for low-skilled jobs, and also the education levels. They tend to have lower level of education. So because these two variables dominate a lot and became very significant from the regression result. So informal workers variable did not turn out to be significant. However, from our experience, day-to-day experience, seeing them is this, many of them feel that, okay, now they need to be formal. They want to be part of the formal sector when they realize that the people who are under Social Security Fund receive, you know, unemployment insurance for up to 200 days. You know, that's quite a good safety net for them, right? And the government can decide to shut down the business, you know, or lock down any businesses like the restaurant, just, you know, easily, and like construction also. So now the informal workers feel, okay, I don't think this is good anymore. I want to be, you know, having a more formal safety net in the future. Yeah, so I hope it will increase the participation rate in the Social Security Fund in the future.
Thank you. Our next question comes from Sarah Reed. She's with Women in the Informal Economy, Globalizing and Organizing. Sarah's question is, it sounds like the half-half scheme has been a relatively successful measure at targeting MSMEs, including in the informal economy, that could be replicated elsewhere. Are soft loans also reaching micro and informal businesses? If not, why not?
Okay, half. Actually, I think this is Thailand copying the program in the UK, because first time I heard about half is from the UK. So I don't think this is Thailand's, only idea. And yes, it's successful. That's why they're doing it third time starting this month. For the soft loans, there's a lot of problem with this, because I also criticize Bank of Thailand a lot, because they want to do all the businesses through the banking sectors. For example, can you imagine if you are a small business, you have to have existing loans with a bank, a commercial banks, and if you not, now they give you a new options that you can go to an office that will guarantee your loans, but you have to pay extra 1.75% for the loans, and the commercial banks will charge you up to 5% already. So you can see that it will be like 6 or 7% interest rate that you have to pay, right? Many people might say, oh, this is much better than loan sharks. But if you go to the US Small Business Administration website, I went there and checked. The loans is for 30 years and the interest rate is less than 1%, like 0.3 or 0.5, I don't remember exactly. So which is so fair. But for Thailand, the time of the loan is only 5 years. You have to repay within 5 years with 6 or 7% interest rate. Outrageous. Why don't you do something like the US Business Administration, Small Business Administration? Mm-hmm.
I'd like to ask a question. We've talked about tourism and how important tourism is to the Thai economy. If I remember correctly, tourism is also the largest foreign exchange generator of any sector of the Thai economy. How has the decline in tourism because of the pandemic, how has it impacted on foreign exchange reserves, and is there a danger of those reserves getting too low?
Not yet. Yeah, the reserve is fine and healthy. The Thai currency is now have been depreciated a little bit, probably by 6%, something like that. Now 32 baht per $1.
Oh, okay.
But in terms of, Thailand has a very strong fiscal. Economic fundamentals of Thailand is really strong. You don't have to worry. Like, we have a lot of reserve, right? And also when it's talking about the debt to GDP ratio, it haven't reached 60% yet, and the government's already kind of like freaked out. Oh, we cannot go over this rate, and so many comments about, is it okay or not okay to go over 60%? And yeah, they're debating on something which is not important. You should be focusing on, now it's time to rescue the people and use all the weapons that you have to put the country back to normal. So I think they totally focusing on the wrong thing now.
Yeah. Our next question comes from Gobi Rajalingam. He's our.
John, do you mind if we jump to Larry's question at the end on vaccination?
Sure, we can do that and then go from there. Sure, Larry Ashman from the University of Wisconsin.
So yeah, I think this is a really important question on vaccination. Sorry, John, to jump in. Look, I think that absolutely the government, is under enormous heat right now for the vaccination program. Basically, just so everybody's sort of aware, Thailand made a deal with AstraZeneca last year, which was widely celebrated here, to manufacture it locally, and it's a company called Siam Bioscience. However, what they did was they didn't make any other arrangements for any other vaccinations to come in. And as a result, when it became clear that there wasn't going to be enough and they were going to come quite late, et cetera, and that they were almost all going to be AstraZeneca, and then the government tried to supplement that with some Sinovac, there was a lot of concerns, and there have been enormous and growing concerns ever since. The government really, I think, this is probably the single biggest challenge the government is facing right now is vaccinations. Thailand is not in a situation where they need donations, but they do need access. And I can tell you that the government, various Thai institutions, even people from the palace have been contacting a lot of American organizations and the embassy to try to get any way of trying to get, any help to try to get US-made vaccines to Thailand. They even contacted us and we said, oh, I can't really do much for you, but so I think that this really is a critical area, and absolutely it would, it would help put the country back on the right foot if they could get there quickly. Keep in mind that the Delta variant now is becoming the dominant variant here. And, the evidence is that Sinovac and AstraZeneca are not particularly effective against it compared to, the mRNA vaccines, for example. So this is going to be an ongoing challenge. We expect, within 3 to 4 months, most of Bangkok should have gotten at least one shot, and quite a few, probably about half of Bangkok will have received 2 or be fully vaccinated. There'll be ongoing challenges with this until at least the first quarter of next year.
Thank you, Tom. Well, we'll go now to Gopi Rajalingam. He's our team leader for the Tourism Development Program for the Asia Foundation's office in Timor-Leste. To what extent is low MSME access to soft loans due to eligibility, or is there also a lack of understanding on how businesses can apply to loans? Did the research find that there is low awareness of government stimulus packages and subsequently low uptake? In Timor-Leste, COVID has not only devastated the tourist economy, but it's also created an information crisis that is delaying recovery. So,
yeah. I would say last year soft loan, before they changed the criteria, had 2 reasons, right? One is people, the businesses were not aware that there were soft loan available, but the more important reason was it was very difficult to apply. As I said before, that you must have existing loan with a bank before, and now for the second round, the Bank of Thailand eliminated that criteria and said, okay, anyone can apply if you need the loans. But still, as of today, like I would say less than 5% of the amount of money that they set aside for soft loan have been used. It's totally still very difficult to get the soft loan because it's up to the commercial banks to make the loans or not. And commercial banks are risk averse, right? They're not gonna make it. They're not gonna trust all these, who they don't know. So they don't follow the suggestion of the Bank of Thailand. So that's why we have a lot of leftover budget from last year for soft loan, and the government has to use it for other things, and then now they have to use this time again. And I don't think it will be successful. It's still a very big obstacle. Yeah.
thank you. Tom, did you want to add anything?
No, John, I think that was good.
With that, we'll conclude. I mean, clearly, if we've learned anything from your comments this morning, that Thailand is facing a very challenging time, and the pandemic, as it has done elsewhere, economically, it's had a devastating effect. But if it's taught anything, this government or any future government, the importance of providing a stronger social safety net for its population, and for the need to reskill people in different sectors where other sectors might not be as vibrant as they once were. So the world is changing, and Thailand will be changing with it. With that, I wanted to thank everyone for their very thoughtful questions, and to Tom and Nelitra for your excellent insight on what's going on and how Thailand is handling the pandemic at this time. I guess the final question from me will be, is there going to be a fourth survey?
Probably not, because if we were going to do it, it probably would need to be done right now. Yeah, so probably not, but we'll be looking, others are also collecting data right now, so we'll be looking to see TDRI, World Bank, and a few others sort of what their results look like.
Okay.
I can predict what they're going to look like.
Well, with that, we'll end there. Thank you very much for talking this evening, and thank you everyone in the audience, both in the United States and Thailand and elsewhere, for participating in today's discussion. Have a good day. Good evening. Good night. Thank you. We'll see you again. Bye-bye. Thanks, Tom.